Hi guys, welcome back to my channel. I go by the name of Suga. For those of you who don't know, I'm sure you guys know the drill by now. You know who I am by now. And if you're new here, welcome. So this is sort of different video, is the health segment part of my channel, and I thought let me just come on here and tell you guys how I'm feeling, especially with the old COVID, being a healthcare professional, working in intensive care for over 11 years now. Yeah, it's 11 years. Over the whole COVID period, this has been the most challenging, difficult time of my career, and my career is critical. So it's already a busy environment, and then having COVID on top of it, I feel like no one is talking about healthcare professional and their state of mind, their mental health. So let me just start off with my job role. I work as an outreach nurse for 50% of my time, and has an intensive care nurse in charge, or sister, or senior staff nurse, whatever you want to call it, other 50% of the time. My main role as a critical care outreach nurse is to prevent the admission into intensive care. So all the patients who are deteriorating on the ward, what I'm doing essentially is stopping them from further deteriorating, or if they do deteriorate, I make sure that a bed is ready for them in a timely manner and there's no delays in their admission into intensive care. I work collaboratively with the ward nurses and the ward registered medical officers, which are called RMOs. We have the ability to quickly identify problem areas and try to fix it and initiate plan of care. We attend all the cardiac arrest, peri-arrest situation, whether it's respiratory arrest or a full cardiac arrest. We're part of the resuscitation team. All outreach nurses are advanced life support trained. And I would also add that ward staff education, teaching is another third important role. There's a lot that goes into it, but this is just a brief overview. On top of that, I'm also, like I said, 50% outreach nurse, 50% critical care nurse in charge. The nurses in critical care look after level 2 or level 3 patients. For most of you, are probably thinking, what the hell does that mean? Ward nurses, they look after level 0 to level 1 patient. When a patient do deteriorate on the ward, that's where my outreach skills come in. Then I make the referrer into intensive care units and talk to the intensive care doctors as well as consultants. Talk to the consultant on the ward, talk to the consultants in critical care, and make a decision whether to admit this patient. If they do need critical care, then it might be for either one organ failure or more. You might need support with your kidneys, you might need support with your lungs, etc, etc. Most of the time they then become a level 2 or level 3 with multi-organ failure. If they're multi-organ failure, they are not sitting on the ward. Trust me, they're in a critical care environment, and that can be high dependency units or intensive care units. So nurse in charge, what I'm doing on a daily basis is just making sure the nurses are supported. I lead the ward round with the doctors, you name it. If a patient was to deteriorate, I'm the first contact. Working in intensive care units is a very, very, very skilled, specialized area. This COVID-19 has really pushed me to the edge. I've never ever been someone who stresses out. In fact, I like pressure. I honestly feel like no one's talking about healthcare professionals and their mental health. I know people are talking about mental health a lot more recently, especially because of COVID-19, but imagine us day in, day out having to go into a stressful work environment, knowing that you're going to be short-staffed. And how are we coping, honestly? Because we all know stress is not a diagnosis. However, if you do not manage your stress, it can lead to mental health problems such as anxiety or depression. And I feel like, I wouldn't say I'm anxious and I wouldn't say I'm depressed, but my current state of mind at the moment is I feel burnt out. I am really burnt out with work and with my workload at work. I am shattered. I'm someone that doesn't even get enough sleep. The most sleep I'll probably say I've had is 5 hours sleep on average every day. Since this pandemic, I've been just cutting back on my sleep. I've been having 3 hours sleep a day and having to go to work, staying at work for sometimes 15 hours. and then coming back home and having to repeat that all over again. Since 2019, since COVID, intensive care is probably the department that has been hit the most with critically ill patients, and we do not have enough nurses. There is not enough nurses to deal with the pandemic. And the fact that nurses, in my opinion, they are treated like the bottom of the food chain, in my opinion. There is no gratitude to being a nurse in the UK. And imagine 1% pay rise. Honestly, I didn't come into nursing for the love of the money, but yes, money is something that needs to be considered when you're choosing your career, because at the end of the day, you still need to put a roof over your head, you still need to pay your bills, you still need to look after yourself. Like Maslow hierarchy of needs, you need all that basic things in your life, and money plays a big part in it. So I wouldn't say I came into nursing for the money, no, because I knew already there wasn't money in nursing, but it was the passion that I had. I'm someone, when I look after someone, I get this joy I can't even describe. I love my job. I'm someone who comes to work with a smile on her face and ready for the day, ready for all those challenges that I'm going to face on that shift. And I embrace every challenge with positive attitude, with positive mindset, because if you're positive about something, you're going into somewhere or going into a situation positive, even if the result is not what you expect, but at least you've done your best. You've had that positive state of mind and ready to take on the world. So when I came into nursing, I was so excited. I was like, wow, imagine making an impact on someone's life, making an impact on someone who is ill, helping them to recover. Like, it doesn't get better than that, in my opinion. It doesn't get better than that. I love the joy knowing that my patients are able to get better. I can't even describe it. It gives me this undescribable joy. But I felt since 2019 my workload has really increased, and it's not for the best. Imagine going to work every day, dreading going to work. The first wave didn't really affect me, to be honest. I was fine with the first wave because everyone was working together. Nurses, doctors, everyone was pulling their weight. They were like, wow, we've been hit by this terrible disease with no cure. Let's just all get on with it, work hard, do the best that we can. That was the sort of mentality and mindset that we all had as healthcare professionals. We worked really hard, but this second wave has affected me differently, in the sense that I just feel so deflated, because now when I go to work, that joy I used to have on my face is now, oh gosh, what is today gonna bring? I'm always praying now, let's just have enough nurses for the day or for the night. That is my thoughts now. I don't even care about the workload. I don't care about the business. It's just having enough nurses to deal with the challenges that we are going to face, because every day in critical care is a challenge. We've been having bad day, and imagine you having bad day at work every day for a year. At some point it will affect you mentally, and I think I'm at that stage now. It's okay to feel like this. Before, I'm like, okay, you're a senior staff nurse, you cannot be vulnerable, you cannot be showing weakness, because how are you motivating your colleagues if you are like that? So when I go to work, I just put a smile on my face, even though that may not be how I'm feeling, but I'm someone that they can lean on, and someone that they can always come to and talk to and say, you know, I'm not coping, I need help. And I would say, you know what, we're all in this together, we can do it. So we all work together, making sure patient safety is our #1 priority, and that's what we have been doing. I've just realized now it's okay to need help from other people. You can't do everything by yourself. I'm such a strong individual. I like to solve things myself. I like to get on with it. I don't complain, but gosh, there's past year I've been complaining non-stop, and it's all to do with staffing. You come to work, imagine you're 8 nurses short. That's not an excuse. To a patient, whether you're short staffed or not, they still expect you to care for them the same way that you would if you was fully staffed. So I was like, okay, come to work, 6 nurses short. IT is supposed to be one-on-one. Sometimes you're 7 nurses short, 6 nurses short, 8 nurses short, and you still have to put a smile on your face and get on with it. And you're in full PPE all day. Can you imagine wearing PPEs all day? It's spring now, it's getting warm. You're in this PPE for 12.5 hours a day, and sometimes I'm doing a 15-hour shift because there will be an emergency, there will be a cardiac arrest, there will be one of your patients in critical care that is sicker than the rest, and you're working hard, working hard, and you get home and then you start to take it out on your loved ones. And so I'm getting to that stage now. I'm really like biting at everything. I'm already someone who's strong individual. I'm already someone who will challenge things, but now it's the way I'm going about it, so it's not so polite anymore. I'm losing myself in a way, and I've actually been giving myself pep talks when I go to work now. I'm like, yes, it's going to be a difficult day, but we will overcome. You can do this because you are strong, you are resilient, and you are determined. Be there for everyone. This is sort of the pep talk I give myself every morning or when I'm going on night shift, and I just pray to God that I'm safe. Pray to God that no one dies on my shift. Pray to God that everyone is fine, the nurses are fine, and even if we do have challenges, we will overcome together. And that's sort of been my mentality since the pandemic and throughout till now. I just want to come on here and say, it's getting too much now. And I'm just glad that lockdown is easing. For those of you who don't live in the UK, this is the 3rd lockdown now. I'm lucky because at the end of the day, I can still escape and go to work. But imagine those of you at home, working from home every day, having to work by yourself. Some of you live alone with no support, no help. It's very isolating. It's very depressing. I can't even imagine what you guys at home must have gone through. It's been a difficult year for each and every one of us. 1 year in a pandemic, it's no joke. And even though the lockdown is easing, we still all have to play our part to be responsible. Guys, do you know the difficult part in all this is the amount of death, the amount of deterioration, the amount of arrest, the amount of peri-arrest. In my whole 11 years of critical care nursing, I've not seen anything like that before, and I'm having trouble accepting it. I'm having trouble switching off. When I'm at home, all I can think about is the amount of death that I've seen. I'm starting to have nightmares now, Sometimes I'll go home, all I can hear is just alarm, ventilators alarm, any form of alarms. That's all I can hear when I'm trying to sleep, and I'm trying to survive on 3 hours sleep, and then I'm back the next day to repeat the cycle all over again. I'm at the stage I'm thinking, wow, what a career. I'm not gonna lie, that's how I'm really feeling. Who is supporting us? Yes, there's helplines. If you need help, you can call, talk to a counsellor, but that's not enough. Because of COVID, I prefer face-to-face interaction. That's why starting this whole YouTube for me to begin with was really strange, because I'm like, how can you talk to a camera? It's really strange. I'm more of the talking face-to-face, I'm more reading people's body language. That is what I thrive on. Communicating with individuals, that is what I thrive on. And now, talking to someone about how I feel over the phone is not the same. For those of you who are feeling exactly the way that I'm feeling as well, I just want you to know there is help out there. you can either call 111 and ask for the crisis team. Go to your GP, let them make that referral as well. You are not alone, honestly. Even if you type on Google, feeling anxious, anxiety, where to seek help, lots of information will come up. You are not alone. It's so funny because I know what I need. I need time off. That is my first step of recovery. I just need time off, whether it's just a month off work, which is never going to happen because we're still in a pandemic. There's still not enough nurses. There's still not enough healthcare professionals in general. So that is not going to happen. So I need to find a way to manage my stress level before it escalates to something else. So what I've started doing is I've got this journal that I write in. What I tend to do is I write positive things about myself in that diary. And then when I'm going to work, I write what I want my outcome to be for the day. So if you're feeling anxious at the moment, a good thing is to revisit what you like doing. Play your favorite music and dance to it, for example. Music is a good therapy for me. So when I'm feeling down, I just play gospel music and really do connect with the lyrics of the music, and just feels like my strength has been renewed. That is one way to alleviate stress. Some people do a self-care day. I know there's been a lot of emphasis about self-care day. With everywhere still closed, I don't even have time to do a self-care day. It's been a struggle even wearing makeup. I used to love wearing makeup, getting dolled up. I used to love reading, but now I've not even had the motivation to read because I'm just exhausted all the time. I've got a lot. My mind is like too many things is going on in my head and it's all negative, and I need to find a way to channel all those negativity and redirect it and turn it into positivity. But how do I do that? So I've been stuck on one book since 2020. So I was so excited to read this book. It's 28 Summer by Elaine Hildebrand. This book, I've not had the motivation to do all those things that I used to love. I was someone who was very sociable. I like socializing, but on my terms. Now, of course, we can't. We're in lockdown. I used to enjoy getting dolled up, going to the restaurants, going to theatres, just meeting up with my friends and just talking over a meal. Can't do any of that. I missed all the date nights I used to go to. There's a plan in place. The lockdown is lifting, and I know once everything starts to open up, then I can sort of revisit all the things that I used to love doing, and hopefully that will have a positive impact on me, and that will have a positive impact on my well-being and my current well-being. I just want to highlight the fact that COVID is not gone. COVID is still very real. Vaccine is now out. At least it's better to stand a chance to be protected against COVID-19 than having nothing at all. What I'm going to say is better days are coming, guys. Look after yourself, look after your mental health. If you do need help, you can seek help. You are not alone. There are millions of people feeling like this because of the pandemic, and imagine all those with mental health problems already before the pandemic, and everything has now escalated. Honestly, guys, look after yourself. That will take us to the end of the video. Thank you so much for listening to me rant. Until next time, guys, take care and God bless.